Hello guys, welcome back to my YouTube channel. Today I'm going to discuss about first cranial nerve, the olfactory nerve. Olfactory nerve begins in the olfactory mucosa of the nasal cavity. You can see the mucus layer here. So the olfactory nerve begins at the mucus layer in the nasal cavity. It consists of bipolar olfactory receptor cells. These are the bipolar olfactory receptor cells. We call them as first order neurons of the olfactory pathway. The unique feature of these neurons is that they develop from the surface ectoderm but not the neuroectoderm. The axons of these bipolar neurons collect together to form a bundle of each olfactory nerve. Here you can see these axons coming here. Here is the cribriform plate. You can see the cribriform plate. So the axons of bipolar olfactory cells pass through cribriform plate here and enter into the anterior cranial fossa, and then at the anterior cranial fossa they terminate into the olfactory bulb. This is the olfactory bulb. You can see this is the olfactory bulb. These bundles of olfactory nerve are surrounded by meninges at the cribriform plate, and they provide a communication between the subarachnoid space and lymphatics of the nasal cavity, as well as it provide a route for the infection from nasal cavity to meninges as well. When we talk about this olfactory bulb, this one is the olfactory bulb. Olfactory bulb is situated in the anterior cranial fossa below the olfactory sulcus on the orbital surface of the frontal lobe of the cerebrum. The main neurons of the olfactory bulb are mitral cells. You can see the mitral cells and then tufted cells. The axons of bipolar olfactory nerves cells synapse with these tufted cells and mitral cells. These neurons are the second order neurons in the olfactory pathway. Then you have the olfactory pathway. You can see the lateral striae. What is the lateral striae? And you can see the medial striae. So the axons of mitral and tufted neurons form olfactory tract on each side. You can see they are going on each side. The olfactory tract runs down backwards and widen in olfactory trigone at the anterior perforated substance. This red color one is the anterior perforated substance, and you can see the lateral and medial olfactory striae extended from the angles of this trigone. This one is the trigone. Then the medial olfactory striae is covered with a thin sheet of gray matter called medial olfactory gyrus, and then medial olfactory gyrus terminates into the paraterminal gyrus in front of the lamina terminalis. Then you have lateral striae. It is covered with a thin sheet of gray matter called lateral olfactory gyrus. Then it terminates in the primary olfactory cortex. You can see lateral striae terminates in the primary olfactory cortex. Then from the primary olfactory cortex, the fibers are projected into the secondary olfactory cortex, which which is situated in the uncus and the adjacent anterior part of the parahippocampal gyrus of the temporal lobe. This primary olfactory cortex consists of anterior perforated substance, lateral olfactory gyrus, olfactory ambience, and part of amygdaloid body. You should know how we test the olfactory nerve in clinical examination. Each nostrils are checked separately with patient's eyes are closed. Ask the patient to identify easily recognizable smell. As an example, lime or Lifebuoy soap or something like that. It should not be harmful or irritant to the patient. Then there are some disease conditions which are associated with this olfactory nerve. One is bilateral anosmia. Bilateral anosmia means the cold allergic rhinitis, damaged olfactory epithelium due to fractures of the cribriform plate, tumors of the frontal lobe, both cortex damage, or due to the aging, loss of nerve fibers due to the aging. Unilateral lesion of cortex does not cause anosmia due to bilateral connection. Then sometimes may be unilateral anosmia as well, hyposmia, hypersmia due to psychiatric conditions sometimes can be seen. So that's all about olfactory nerve. It's very easy pathway, and hope you clearly understood this pathway. Thank you for watching.